control pill. And you'll be treated in a way that disrespects the natural ecology of your body and that treats your fertility as a disease. And much of what is practiced there goes against Catholic teaching. So for couples who have issues with this, and a lot of people do, we need to make Catholic services available. The call from Pope Paul VI in the encyclical Humanae Vitae, he challenged men of science, male and female, to develop means of regulating fertility in keeping with the moral law. Professor Hildreth was a fourth-year medical student when the encyclical came out, and when he read this, he felt like the Pope was talking to him personally to do this, and he couldn't get away from it, and he's been working in it ever since. And he saw it as an invitation to rich human love. He saw that aspect of it. He didn't see the set of unjust prohibitions that the media were clamouring about and that the dissenting theologians were talking about. He saw it as a beautiful invitation to rich human love. So he dedicated his whole career to research in this area. And essentially what he did in the end was he came up with a standardized modification of the Billings ovulation method. And he would, if he's the father of the fertility care system, he would consider John and Evelyn Billings to be the grandparents of it. And the ideas that they came out with Billings are what led to this Creighton model system. But it's a standardized version of Billings. And Billings is fantastic from a family planning point of view. But when it comes to what we do from an infertility and gynecologic health intervention, remember Professor Hildreth is a gynecologist, you need a bit more detail, and this is why he standardized it, so he could be able to apply the best gynecologic, medical and surgical techniques to optimize female reproductive health. It's based on the idea that women observe the different discharges, the most important one being mucus discharge. The charting of the stamps is identical to Billings, but the coded description underneath each stamp is completely different. It's a very precise coded system to document exactly what the discharge looks like, and we can interpret that to understand, does this couple have a normal fertility potential, or is there something abnormal in the fertility care charting pattern? From a family planning point of view, the biggest study that they published was in 1998 in the Journal of Reproductive Medicine, and I meant to bring my pointer, but at the bottom left-hand corner, you get the success rate that it's 96.8% effective for 12 months of use for couples who wish to use the system to avoid conception, which is as effective as any birth control pill, about 3% pregnancy rate per year. Whether you're dealing with hormonal contraception or a natural system of family planning, you'll never get 100%. There will always be a pregnancy rate as opposed to a failure rate. We don't regard pregnancy as a failure, and very much Professor Hildreth has used terminology that would remove the contraceptive mentality from the thinking with fertility care and NAPRO technology. When you talk about the fertility chart, you don't have safe days. You've got fertile days, because the implication, you've got infertile days. The implication of a safe day is the other days are dangerous. And they're not. They're fertile or they're infertile, and you use the system according to your intentions. So very much he's very careful and I think wise with his choice of terminology. And we're not contraceptively biased with this, that if couples choose to use the system to become pregnant, fine, that's always their choice, so long as they do it in a way that they know and they're empowered with that. That study, by the way, it was from 5 different centres scattered throughout the United States between 1980 and 1994, and there were 17,000 cycles studied. So it's not like it was 10 or 20 people who were highly motivated and so on. It was real use of it throughout 5 different centres in the United States with a large number of cycles. So we know that in practice it is highly effective for family planning. But as a result of the Creighton model system for family planning, NAPRO technology came to be. And NAPRO technology is a new reproductive science that is developed as a result of precise information that the fertility care system provides. So if you have a couple who wants to make a good choice for family planning, I would often recommend, well, look, you can choose any of the natural methods, symptothermal, Billings ovulation method, fertility care. I would have a preference for fertility care being a physician because I think it gives us certain medical advantages. But any of the systems would be good choices. And especially then when you come to the need for gynecologic health maintenance, NAPRO technology is where fertility care really comes into its own. That's a picture of the man behind all of this, and in 1990 he coined the term of NAPRO technology, and he's done this in association with Creighton University in Omaha, Nebraska. NAPRO technology uses the most modern medical and surgical techniques to facilitate conception through normal intercourse. And yes, it is inspired by Catholic thinking, but remember its application is universal. Any medical patient can benefit from it. It's been available in Ireland, thank God, since 1998, and we've been blessed with over 900 Irish babies. And we've been looking at our figures since the start of this year, and we've had over one positive test for every working day so far in 2009. In our clinic in Galway, we've got 3 physicians working there, and we really have a system that's working very well at present, thank God. Most couples come to us because they want a baby, and some would come and they'd say, well, you sound very Catholic, but I think we'll try it anyway. There are many publications regarding the medical and surgical techniques that we apply, but they're not well known. So to overcome that information deficit, Professor Hilders pulled together this large textbook in 2004, which is available at naprotechnology.com, and it explains the science behind what we do with NAPRO technology. There are 1,200 pages in this and 90 chapters. I contributed 2 chapters from a GP perspective of what we had been doing for the early years with NAPRO technology. So any doctor can get this information. In Galway, in our practice, we were the first ones to publish in a scientific peer-reviewed medical journal about the success rate for NAPRO technology. So if you do a Medline search on NAPRO technology, you'll find 2 publications, one in a journal of ethics and the other, which is a medical journal, and this documents our success rates for the first 4 years of practice. And on one level, I could be proud that we were the first ones to publish the figures on it. Our crude success rate was 25% and our adjusted rate is 52%. Now, the difference between those 2 figures is the crude rate is if somebody came to us and we know for sure that they started NAPRO technology medical treatment and they came back for a medical review, they're counted in our figures if they only came for 2 medical consultations. On average, we need about 4, maybe 5 consultations to get a successful pregnancy. Sometimes we need about 7 consultations, and it can take up to 2 years before we reach the conclusion to say, you know what, we've tried our best, we have to stop. So for the people who dropped out early, if we include all of those, we're getting a 25% success rate. For those who are more tenacious and stuck it out for longer, we're getting closer to 52%. So that's how you interpret those figures. So what's new about NAPRO technology? Well, it's because we use the fertility care charting system to guide investigation and treatment, and the chart speaks a language to us about the couple's fertility. Thankfully, in Europe, NAPRO technology is growing. There are 23 European doctors and 75 teachers scattered throughout Europe. More information about these is available at the website fertilitycare.net. They're all listed on our website there. We've got a nice little 14-minute DVD presentation there as well that's well worth watching if you're interested at some stage. Our average success rate is about 50% for infertility. Even if you've had repeated failed IVF, we get about a 20 to 30% success. That's from our early figures. We're probably better now because we've copped on to things that we can do to improve the outcome for those with a history of failed IVF. So our success rates seem to be improving all the time. With recurrent miscarriages, we're about 80% successful. I had one couple, they had 7 recurrent miscarriages. They were at every fertility clinic, including St. Mary's in London, which is supposed to be the best place in Europe for investigations. And sadly, they went there without success. And we found the problem with the NAPRO technology technique. They went to the top professors. I used to get nervous treating couples who had been to different consultant obstetrician gynecologists and then professors and top people in the field, because being a GP recommending different things, I said, well, gosh, you know, you've done everything, maybe I might be wasting your time. But I've been 11 years in practice, and the longer I've been in practice, the more confident I am in the techniques that we recommend, because this couple that had 7 recurrent pregnancy losses of unexplained cause came to us in their mid-30s, and they've since just recently had their 4th successful pregnancy with NAPRO technology. That once we cracked the code with them, we're able to get success repeatedly despite her difficult history. What we do is science and medicine, but it is inspired by God. It is a work of love, and it's a vocation and a beautiful calling to serve couples who are in need. Currently, I'm the director of the registered charity of Fertility Care Centres of Europe. That was our 10th birthday party, and we had about 1,000 people came to Galway in April of last year, including 500 children that were born as a result of the NAPRO technology techniques. And I just wanted to really mark the occasion, and in fact we flew Professor Hilders over because he was the origin and inspiration to this, and I was really wanting the couples to recognise where this has come from, but I got swamped on the day more than I had expected to, and there was an incredible thing that happened there, because we experienced something of this civilization of love that the Holy Father talks about in the encyclical Evangelium Vitae. Where there was an incredible, palpable atmosphere of joy. You were talking about earlier, Peter was talking about these things that you feel, that you express of yourself, that you can't actually see it physically or touch it, but there's an atmosphere that a person gives, when you touch them and everything else. Well, it's like this whole thing was coming out of all the kids that were there, and there's this incredible atmosphere of joy. You walk into the room, and all of a sudden you go, how come I feel so good? And everybody just, it was really, really very, very special, and it was a thing that it was unexpected on our part, but a lot of the people who were involved in getting fertility care up and running in Ireland were there and were very, very moved by that whole atmosphere. And that was nearly more than anything else that happened, even though people said different things. It was this whole atmosphere that came with it. And it's a beautiful thing. And if this is what happens in a small room of 1,000 people, what will it do culturally? What will it do for all the social ills that we're experiencing at the moment? There's a real imperative to live in truth, to live in beauty, and watch what it'll do for all of culture and all of society. And more than passing different laws and everything, I think what Kathy Sinnott was saying earlier is for us to live this ourselves and promote this and watch what it does. And other people will look at the joy we have and say, I want some of that. What's this person doing? So, well, I use fertility care for family planning. So the other dimension, the NAPRO technology, which is most of the work that I do, we work with the fertility care chart, and we know what a normal pattern should look like. For couples of normal fertility that deliberately, knowingly use the fertile time and try to get pregnant, we get about 98% of the couples will be pregnant after 6 months of trying. So it's very effective if you to avoid pregnancy, which we've already looked at, and then when you say, actually we're ready to try now, you start to use the fertile time, we'd expect within 6 cycles most couples should be pregnant when using fertility care. But apart from just using the window of fertility, could the charts be telling us something more? And Professor Hilders and his team noticed that there was something different about the charts from couples that were suffering from infertility and miscarriage. And these are different patterns of limited mucus flow on the first line, a very short luteal phase or second half of the cycle in the second line. The third line shows abnormal spotting, abnormal bleeding, and all of these things are coming out of the fertility care chart that a couple are using for family planning. And even before a couple tries to get pregnant, one of our teachers, who aren't even doctors, can look at that couple and say, I know you're using this for family planning, but you're at risk of infertility, you're at risk of miscarriage. See a doctor before you even try to get pregnant, so we can avoid you having a year of infertility and avoid you having 3 recurrent miscarriages, because medicine today says fertility is not a problem till you're trying for at least 1 year, possibly 2 if you're only 30. And then we consider it a problem if you're not pregnant after 2 years. We've got something radically different, light years ahead of what's currently recommended, and I can't understand for the life of me how come this message keeps falling on deaf ears. we've seen the benefits of this, and any couple, I would think, that wants a family planning system, I would say, well, it's good to get a handle on what is your fertility like. And this is often telling us that there's an ill health condition that's causing your reproductive system to malfunction. It's not just your reproductive system. There's some underlying ill health condition. So initially we felt this was all about reproduction. There's something wrong with your ovaries. There's something wrong here. It's your overall health. And it's not just your reproductive health, but it's your lifetime health that stands to benefit from this, which is why I'd be so passionate about fertility care and NAPRO technology as a family planning choice, because it opens up this whole vista of really good health prevention and health care for all of your health. These are all examples that Dr. Hilger studied with hormonal studies based on abnormal charts. In the very beginning, they did a whole load of ultrasound studies, blood tests, and they were able to pull together a lot of scientific data that I'm not going to bore you to tears with now, but just to give you the idea that a lot of scientific research, the basic hard graft scientific research of ultrasound scans, blood tests, correlating that with the fertility care chart, all of these things have been pulled together so that now we have a system when we just look at the chart itself, we can say, okay, we need to run a couple of tests and put you on treatment to get normality back to your chart so your health will improve as well as your fertility. I won't go through all the details of this because I know we're going to run on too long, but we can predict couples at risk of miscarriage, as well as ectopic pregnancy, as well as infertility, as well as premature delivery. We see an abnormality there, we say you're an at-risk person, let's do something to sort it out. So this stunning new concept that is radically new and not within current practices, by documenting the biological markers of fertility, we can assess a couple's fertility potential even before they attempt conception. We can identify the abnormal charting patterns, and we can intervene proactively, identifying at-risk couples and helping them even before the problem officially exists. Plus, our fertility care charting pattern, this is the beauty of it, we think we get the answer and we say, well, I know what's wrong with your chart, we're going to do this, that and the other, we'll get your chart right. So you apply your treatment and you find the chart is still abnormal, and your chart is kind of saying, you got it wrong that time, doctor, try again. Because we've noticed different charting patterns